Hello, everyone. I'm Mallory Simons. I'm one of the gastroenterology fellows at Johns Hopkins, and it is my pleasure to introduce Dr. Olaya Brewer and Dr. Mohamad Dbouk. They, with senior author Dr. Mimi Canto, are the first authors of the recently published study in gastrointestinal endoscopy, Initial Multicenter Experience with Nitric Oxide Cryoballoon for Treatment of Flat Duodenal Adenomas. So, Dr. Brewer, why do cryotherapy in the duodenum?
Thanks, Mal. That's a great question. So the idea came because we have a patient with familial adenomatosis polyposis, FIP, who had 2 different episodes of delayed upper GI bleeding after EMR that require hospitalization. So this patient came to us and said, hey, do we have any alternatives? So this prompted the question, can we do this in the duodenum? Also, we have ample experience using cryotherapy in Barrett's esophagus. So we thought that treating Barrett's esophagus, which is flat usually, we could translate this easily into flat duodenal polyps. We just realized that the dose we use for Barrett's will be a little bit will be greater in the duodenal polyps since they are a little bit raised. So we used, instead of 10 seconds, we used 12 to 14 seconds.
I think that's incredibly innovative to just use it, we know as an effective therapy in one organ and just transition it to a different location in the GI tract. But tell me, Dr. Dbouk, why cryoballoon versus cryotherapy?
Thanks, Bob. That's one of the main questions that can come up after this study. And basically, with the cryoballoon ablation system that we are using, the entire cryogen dose is contained within the inflated balloon. So the gas is not in circulation with the open air of the lumen. On the other hand, for example, with spray cryotherapy, the excess gas is in circulation with the lumen, and it cannot be readily suctioned back and can accumulate in the small intestine and cause more discomfort and pain. The same thing applies with efficacy. Since also the dose is entirely within the balloon, it can be more effective and efficient as compared to spray cryotherapy, where the excess gas can be off target and decrease its efficiency.
That's great. So, Dr. Brewer, is there any differences when treating using cryoballoon in the duodenum versus the esophagus?
Well, the esophagus is a straight tubular organ, while the duodenum, especially the proximal duodenum, is curved and more vascular. So we had to ask ourselves if this was going to actually be technically feasible. And obviously it was. Also, there are 2 types of cryocatheters: the focal, which is straight balloon, and then there is a pear-shaped balloon. So when we encounter polyps in the curve or at difficult locations, we use the pear-shaped catheter, which helped overcome and the difficulty and actually achieve stability.
Very, very innovative. So, Dr. Dbouk, what'd you find?
Thank you, Rob. So basically, this was a feasibility study. So it was a retrospective multi-center study involving 5 different centers in the US. We had a total of 17 duodenal adenomas in 13 different patients. Around a quarter of those adenomas were treatment naive. In terms of feasibility, all the procedures were technically feasible, technically successful. We did not have any adverse events on post-procedural pain that required narcotics. In terms of efficacy, all the duodenal adenomas had more than 50% decrease in the size after cryoballoon ablation. And interestingly, 12 out of those adenomas had complete eradication of the duodenal adenoma, and they maintained a recurrence-free survival after a median follow-up of 15 months.
Yeah, and I think that's an extremely important finding. Anything that we know that the sporadic duodenal adenomas have a variable complete resection rate and also a high rate of recurrence. So any technique that we can do to decrease the rate of recurrence in the safest manner possible, I think is a huge win for for these patients, and especially from what Dr. Brewer, your patient, that initially motivated you all to do this study. So Dr. Brewer, what's next?
C2D2.
C2D2, what's that?
It's a prospective multicenter study measuring the similar outcomes, but in a prospective way. Mohammed, what else?
So the hope is that we can build up on the results of the prospective C2D2 study and our retrospective study, so that we can eventually design a study that can compare the traditional resection techniques to treat duodenal adenomas like EMR, EST, and compare them to cryoballoon ablation, one-to-one or other randomized studies, so that we can eventually come up with the best modality for the treatment of duodenal adenomas.
Well, once again, congratulations on the completion of this study. I look forward to see those results and the future studies coming from it. I thought this was a really interesting, innovative study, and it was done by some great people that I know very well and have a lot of respect for. So thank you both so much for your time. And also thank you all for joining and tuning in for this session of GIE Author Interview.
Thank you, Ma.